Thank you, Prateek, for including me in this program. As you said, this is a bit of a controversial topic because there are no straight answers here. Glaucoma treatment actually is a significant financial burden on patients because this is a lifelong disease and you need a lifelong therapy. There are not only direct costs, that's cost for medicine, tests, etc., but there are many indirect costs also, the hospital fees, travel time, loss of wages, so it kind of adds up. And even if you look at the direct cost, if someone is on 2 or 3 drugs, you can easily spend 1,000 to 2,000 rupees per month on anti-glaucoma drugs, and that builds up over a period of time. So I think financial implications are really there, and we are not talking about the other, the social disadvantages here, but it's significant. So the reducing treatment cost is very important, and that's why this issue is branded drugs versus generic drugs, because the branded drugs tend to be very expensive and the generic drugs are much cheaper as compared to that. So that's the reason the governments, the patients groups, they are always supportive of using generics, and they want actually us to use generics. But to providers, it creates a bit of a dilemma because we want to give the best possible treatment, but we also want to reduce the cost. So I think as a physician, we also want the patient should not pay a lot of money on drugs. So that's kind of is a tight balance that we have to consider, and every day that's a problem for us. So what is a branded or a generic drug? A branded drug basically is a medicine that is discovered, developed, marketed by an entity, usually a pharmaceutical company. Now, these drugs are standardized, and the formulation, the manufacturing process, everything is standardized. So that means there's a more consistent product is there, and you are getting what you are being told. But it comes at a cost because everything costs. The generic medicine, on the other hand, contains the same active ingredient, but it has not gone through all these procedures because the molecule is known now and anyone can manufacture that molecule. So that's why these drugs, the generics would be very cheaper. There's another term you'll come across, this branded generic or authorized generic. So maybe you might have heard this term. This basically means that a branded generic, a branded drug, which has gone off patent, because there's a time limit to a patent. You can hold patent for 10, 15 years. You have the exclusive rights, but after that it can be open. So the same process, same molecule can be copied over again by the other companies. But typically what happens is that the parent company, actually they relaunch their products at a lower cost under a different brand name. So that kind of becomes another generic, which is called an authorized generic or a branded generic. Now, before you can introduce a generic into the market, there are certain things which are to be fulfilled. And that is the most important thing, is the bioequivalence. So the drug that you are marketing as generic has to have the same molecule in the same concentration marketed. And this is not very difficult to achieve, and this is mostly lab-based, so most companies, they will probably fulfill this criteria, and that's how they are allowed to come to the market in the first place. But the other important criteria is the therapeutic equivalence. Now, this is very difficult to manage, and most of the generic companies, they actually do not do any therapeutic trials. No patient trials are done. So the therapeutic equivalence is only presumed. So all these generic drugs that we are using, we say that there's a presumption that they are therapeutically equivalent to the generic. They may be, they may not be, and that's where the dilemma arises, why it happens. But because we know the differences in manufacturing processes and the composition, differences in the composition exist between, in the same molecule, between different generics as compared to the branded. So that's kind of is a reality. So are generics equal to the branded? Now that is the big question, and unfortunately there's no straight answer to this, because this will varies with the drug, the molecule, the country, the regulatory setup, and many other factors. Now, to give you an example from the US Health Registry data, now this was on anti-epileptic drugs. So they tested a few anti-epileptic drugs from their database of the patient users, and they found that the success reporting and the side effect reporting was actually very similar in both the generics as well as the branded drugs. So they concluded that actually no difference as if you're using anti-epileptic drugs in USA, whether you use generic or branded. But the same drugs, when they were tested, the same survey was done in Germany, and the results were different. They found that switching the manufacturer of anti-epileptic drug is associated with higher risk of seizures. So I think it's also, so it depends. So it's the same drug, same molecule, but I think how it's made, how it's marketed, that also makes a difference. And also, so what is important is the quality control. So quality check is very important for all these drugs. And the problem is that the many countries do not have resources or expertise to conduct that quality checks, or sometimes they don't have the will to do it actually, even if the expertise is there or the resources are there. So as a result, substandard drugs, they come into the market. Now here we are not actually talking about another class of drugs. Now if you're in Delhi, I think Devendra will weigh me out, if you go to Bhagirath Palace, you can buy any drug from anti-glaucoma to anti-cancer at any price you want. Now, there's a different class, or that's called counterfeit drugs. So here we are not. So counterfeit drugs are different. So generics are not counterfeits that we have to remember. They are kind of the same active ingredient which goes into a branded drug, but then the standard of manufacturing and other things could be different. Now, this is one data from India. I think Tanuj published it recently. So what they did, they looked at the different brands of the travoprost. They didn't do the therapeutic equivalence, which is the most important and very difficult to do, actually. But what they only looked at the physical properties of the drugs, like the spectral analysis of the drug, the turbidity, the pH of the drugs, and they did find that there were differences in different brands that were available, different formulations that were available in India. So the study underscores the need for better quality control in the production of a generic travoprost formulations. Another study, now this is from US, again, it depends, because this is, again, they studied the latanoprost. This is again from the user registry, like 7,000 prescriptions they studied and followed them up. And what they looked at, that if the patient was put on a generic or a branded latanoprost, what were the chances that he needed further interventions or change in the therapy? And they didn't find any change. So generics were no less and possibly more effective in preventing need for additional interventions than branded PGs. In fact, in this study, the generics were found to be better than the branded drugs. So what this means is that there are variations, and it depends on where you are practicing and what is the quality control is. So the question is, should the generics be used? Again, there's no clear answer. I mean, it depends on where you are, and but there are two things. Is that most generics seems to work, but we also know there are exceptions. When it's okay to use generics. Now, if you look at that angle, then if you're doing a short-term therapy, so if your IOP rise is short-term, post-procedure, post-surgery, and is going to be, the patient is going to be off drugs in a short time, you can use actually any brand, because you are monitoring that patient more closely anyway, so you'll know the therapeutic value as well. Other thing is that if the molecule is stable, the formulation is stable, and then also it's okay to use generics. So that's easy to manufacture, that's easy to market. And timolol is a good combination. Timolol goes with most of the combinations. And so if you are using a generic of timolol, probably it's okay to use it. But in case of complex molecules, you have to be careful, and you have to be monitor these patients more carefully. So to summarize, the branded drugs have an edge in terms of quality control, but they tend to be more expensive. Our patients need the best care, but at a reasonable cost. Authorized generics could play a role here, and they're already playing. And if you're using purely a generic drug, then monitor the therapeutic effect as well as the side effect more carefully. Thank you very much.